Hello, I'm Celeste Schillenthaler, the Executive Director of Olympic Community of Health. As the 5-year Medicaid transformation project begins to wind down in 2021, OCH and our board of directors are starting to think about what might come next for our organization. In early 2020, the OCH board formed a visioning task force, a small group of board members led by Dr. Mike Maxwell, to begin to brainstorm a future state proposal for OCH. The board reviewed this in September of 2020. Today, I'd like to review the draft proposal and thinking with you and to ask for your feedback as the region co-creates a role for OCH post-Medicaid transformation. Following this video, you'll be asked to take a brief survey to share your thoughts about the draft proposal. We value your perspective and believe that your feedback will help strengthen OCH's path for the future. These next few slides summarize the approach and work of OCH today. Currently, OCH serves and supports the 3-county region of Clallam, Jefferson, and Kitsap counties, and we partner with many of the sovereign tribal nations within the region. Our focus is primarily on Medicaid beneficiaries, and we contract with a variety of partners throughout the area to transform healthcare delivery with the aims of improving health outcomes, lowering costs, and improving the patient experience. We do this by supporting innovative and evidence-based activities around these 6 project areas. For example, many of you know of our collaborative efforts to reduce opioid deaths and improve opioid treatment options, and of the work happening across the region to reduce unnecessary use of our busy emergency departments through community health workers, community paramedics, and more. In addition to contracting with partners to advance transformation efforts, we support active networks of partners known as natural communities of care. And OCH hosts a variety of learnings and convenings to support collaboration, learning, and sharing of local successes. When the COVID-19 pandemic arrived in the region, OCH adjusted operations to support the region's response, including additional funding, masks and other PPE distribution, telehealth support, resources, community-wide education campaigns, and more. OCH recognized that social needs were likely to be exacerbated based on the pandemic, so we spent time reviewing how adverse social conditions across the region are impacting health and exploring opportunities for region-wide collaborative interventions. This chart summarizes how partners across the region would like to prioritize addressing social needs and determinants of health. Those higher up on the chart were deemed by partners to be easier to address. Those on the far right would have greater impact on the region's communities. And the bigger the bubble, the higher the response about priorities that would benefit from a collective regional response. The newly formed OCH Visioning Task Force reviewed all of this, as well as input and feedback from regional partners, state partners, and others to begin to chart a potential path forward for OCH, beginning with a value proposition. Time and time again, OCH is commended for our work in bringing together historically siloed or disconnected partners. Through our work so far, partners recognize that we're stronger together. This value proposition is the North Star for the rest of the future state proposal. A value proposition is a statement that expresses why someone should get involved with OCH and what value we have to offer. We hope that the future state of OCH continues to add value to the work you do. As you can see on this slide, many of you have shared with us that you enjoy the opportunities for collaboration, sharing of information, relationship building, and opportunities to collectively build on successes. In thinking about a goal for the organization once Medicaid transformation comes to a close, we wanted to prioritize a strategic framework that helps to support the goals of partner organizations without too much duplication or overlap, all while working in alignment with the value proposition. 2 potential areas for support are emerging: co-creation of a region-wide equity agenda, and efforts to address and improve social needs and the determinants of health. To maximize whole person health and to ensure better health outcomes, OCH can strengthen the link between healthcare delivery and the social factors that keep people healthy. This involves supporting funding for this work, expanding capacity for data, building capacity among partners, coordinating like projects to maximize partner efforts, and more. Our overarching themes will remain. You'll see us continue to commit to equity, resiliency, relationships, and flexibility. These are the roles OCH would serve in the proposed future state. These should feel pretty similar to who we are today. These roles reflect the unique ways that Olympic Community of Health can support health improvement, healthcare transformation, and add value to organizations and tribes across the region. Thank you for your time in watching this video. Next, we are asking you to take a survey, which should take about 10 minutes to complete, to share your insights about OCH's future. Once we hear from all of our partners, we'll be sure to share back, and we look forward to working together to ensure a positive vision for this collective work.